Rheumatology is a specialty that deal with diseases affecting the joints, the bones, and the connective tissue. And so what we do here in the rheumatology clinic is to identify patients with rheumatologic conditions such as lupus, rheumatoid arthritis, osteoporosis, gout, etc., and get them on the proper treatment to help them get better and feel better and get their quality of life back.
Dr. Tran and I had known each other while we were at UAB. I was the program director, so in charge of the fellowship program, and Dr. Tran was one of the fellows. So we worked together closely in that setting. We can discuss complex cases, we can cover for each other, and share our staff. The staff is trained and they know both of us, so that it really does provide a continuity aspect of care. Even despite us having our own patients, we frequently do share some responsibilities, as well as it's important to have a team when you have complicated patients.
We can collaborate, and I really think that's really important in that I think we collaborate very well, and we bounce ideas off of each other, and Laura has many amazing ideas, and I'm really blessed. I feel really blessed to be able to work with her. We do in-office ultrasound. We can use ultrasound as a diagnostic tool as well as therapeutic, where we can use it to help guide the needle into the joint so the patient can get their blood work done on the same day. And we also have x-ray within the hospital, so they don't really have to drive anywhere to get imaging done.
Additionally, we are right next door to the infusion center, so many of our patients who need infusions for treatment, we can organize those infusions and even see patients when they're infusion to try to accommodate them so they're not traveling so much. And I think one of the unique aspects of our clinic is we have an in-house pharmacist that has been extremely helpful for patients to help with education, new medication starts, do a lot of teaching if it's an injection.
Where we are located, parking is very accessible to a lot of our patients. And of course, we have ancillary services that's convenient for the patient. They can see us, get blood work on the same day in the same area, and also get x-rays and other imaging within the same facility.
And I think when we work together, we're always trying to think of innovative and efficient ways to care for our patients. Dr. Tran and I both go to different meetings focused in rheumatology. We just get good ideas about just bringing new things to this area and caring for the patients.
So I'm a local chapter leader for the Association of Women in Rheumatology, where we talked about how to empower women in medicine and also in the field of rheumatology. And I get to bring these ideas back to our clinic and see how we can incorporate these ideas that I hear of different physicians who have been using these ideas successfully in their practice, and how we can incorporate it into our practice.
We are fortunate to have a span of patients. We have many college students that have just moved away for the first time, and they might have a rheumatologic condition and need a rheumatologist to follow them along and make sure that they do well during their college years. And then we also have a large retirement community that's very healthy and active, and we want to keep them doing all the things they want to do. We don't have many barriers when it comes to insurance and coverage of patients that I think allows us to see patients regardless of different types of insurance. And I think in the marketplace now that can be difficult to find a clinic that can accommodate people with various types of coverage, and we always try to work with the patient and their insurance to provide the best care possible, and that includes the medications as well.
I think we share the same goal in terms of providing the best patient care possible, and however we can do it, whether we go the extra mile to call the physicians to see how we can get the patient the care that they need. And so it's nice to work with another physician who have that same goal, so that we form a team. And I think our staff see that vision And so that's really important to me and to us. And I hope that reflect in our practice at East Alabama Rheumatology Center.